There's literally insurance companies that tells me what implants I can use in surgery. If I don't use an implant that is dictated by the insurance company, then they won't pay me. All right guys, Dr. Webb here. Welcome to a day in my life. Very busy day. I'm not in the operating room, but I am doing pretty much everything else. Kind of the behind the scenes of what it takes to be a surgeon. It's about 7:15, just got some breakfast, some coffee. We're gonna head to my office. Usually the first beginning of the weeks, we have a administrative meeting. This is with the president of the company, our finance director, our clinical operations coordinator, and we just talk about the day-to-day logistics of how to run a practice and how we're doing from a financial standpoint. This is the stuff they don't really teach us in medical school. How to deal with employees. Unfortunately, we have to let some employees go, hiring new employees. I have that, I have clinic today. I have several meetings sprinkled throughout the day. I have a podcast interview with Dr. Glaucoma Flecken. That's coming up today. And then going back to my college this evening, I have a talk that I'm giving to the pre-med students tonight. That's at 7:30, so jam-packed day. We're gonna get started. You guys gonna hang out with me. All right, so I just got out of an administrative meeting and I have about 5 phone calls. These are with patients that I have surgeries being scheduled. A lot of what I do is behind the scenes, things that I have to get done prior to doing surgery. The part of medicine that really no one talks about, kind of going through this administrative kind of burden of running a practice.
Perfect, Dr. Webb.
Okay, thank you, Bye-bye.
Bye-bye.
All right, so one of the hardest parts about being in practice, actually there's a few things. The first thing is actually telling a patient that I can't help them. So there are a lot of patients that come to my office in severe and debilitating pain. I have to make a decision as a surgeon of whether I think whatever I can do can make them better. So unfortunately, I learned really quickly in practice that I can't help everybody. There are some patients that they have comorbidities, medical problems that preclude a safe operation. Spine surgery is very high risk, and you have to have really good indications for surgery. Otherwise, patients are going to have bad outcomes. So that's the hardest part. Was just meeting with a patient earlier today. I felt really bad because the guy was in severe pain, and he looked at me like, "Dr. Webb, you please help me." But when someone's had 7, 8, 9 surgeries, there's not much else I can do. So that's the hard part. The other part is seeing things I've never seen before. Medical school, residency, fellowship, they don't teach you everything. It's impossible. About to see a patient now who had a disc replacement. It's a procedure in his neck with an implant that we don't use anymore. So I had to call one of my mentors from fellowship and asked him kind of what do I do in this situation. Got a CT scan or a CAT scan of his neck. We're about to go meet the patient and figure out what I'm gonna do, but that's the hard part. That's why I call it practicing medicine, because it's a lot of using what you've learned, using things that you saw, your training to come up with a plan for a patient. So. So I have this patient who had this previous cervical disc replacement and severe pain. So the main thing I want to really just rule out and make sure that's not happening is that the implant has worn out or the parts are worn out. A lot of the parts that we use in spine surgery and orthopedic surgery, they don't last forever. So I'm gonna go check him out and see how he's doing. Hello, good morning. How are you guys doing?
Yeah, how about yourself?
Yeah, doing well, doing well. Yep, they're very welcome. Hang tight 1 second, okay?
Okay.
All right, no worries. Hello.
Hello.
Good morning, I'm Dr. Webb. Nice to meet you. Hello, nice to meet you. All right, we're just discussing your case outside. How bad is this bothering you? So I'm about to do a phone call, telemedicine visit for one of my patients who's having surgery tomorrow. Typically, I call every patient before surgery, the day before, just to check in with them to see if they have any last minute questions, and also just make sure we're on the same page. So I think patient education is extremely important, just having patients understand exactly what we're doing, which can be very confusing at times. If you have questions that come up, please write them down and I'll answer them for you in the morning. And I look forward to taking care of you, okay?
I appreciate it, Doctor.
All right, see you tomorrow. Bye-bye. So a lot of my job deals with patient education. And that's why I try to put out a lot of content online, social media, videos. I don't know much about cars, so I always give this analogy that patients come to my office. It's kind of like me going to the dealership. I don't know anything about the transmission, the motor, how all those things work. So when I go to the dealership, I want them to break it down to me where I can understand it in layman's terms. Some patients come in, I have to really break it down to them. This is the disc. This is what a disc herniation looks like when it's spitting out, pushing on the nerve, using like aids, video, pictures. I think everybody learns a little bit different, and especially spine surgery where it's very hard to understand. So that's why I try to really break it down to my patients. Most patients that come to the office, we try to avoid surgery and use that only if needed. This gentleman came as a new patient today with severe neck and arm pain, and he's having some weakness in his arm also. So I think this is something that we should certainly just watch for now conservatively. Try some physical therapy, try an injection and see if that helps, and if it doesn't, we're going to talk about surgery. So this is the patient's cervical x-ray here. You see that he has a pretty severe collapse at this level and a huge bone spur here, some collapse at this level, but this is 3, 4, 5, 6. This is the level where there is the severe compression of the nerve. This is the patient's cervical MRI here. This is the spinal cord coming out of the brain, at the base of the brain here. And if we look at this level, which is 3, 4, 5, 6, this corresponds with the patient's symptoms. So there's severe compression of the spinal cord right there. Some of that disc is pushed out and is pressing on the spinal cord. We can also see that when I look at what's called the axial view. If I scroll down to this level here, there's loss of the cerebral spinal fluid here, and there's severe compression on this left side here. So we're going to try some conservative options. If that doesn't work, then we're going to resort to surgery. Hello.
Hi.
Hey, how are you? I'm Dr. Webb. Nice to meet you. And now your pain's in your back, and does it shoot to your legs at all?
Yeah, my left leg. I've always had problems with my left leg.
Okay. And then which one hurts more, your back or your leg?
My back.
Your back does? And the pain that shoots down, where does it run? Is that the front of your leg or the back?
It usually runs the back of my thigh.
Okay.
I don't really feel it in my calf, but
Okay.
I feel it in the bottom of my foot to my toes.
When you have this much force kind of run across that this L5S1 level, typically, we would put pedicle screws in here to hold it in place. I do think that putting the implants just without pedicle screws puts a lot of pressure on those implants. And I can see the defects here into the bone, the pars defects, but most people would agree that this procedure, this condition here requires supplementation. Yes. Yeah, let's get that CT scan and we'll meet and kind of figure out what we need to do.
Okay, well, thank you.
All right, very nice to meet you, okay? All right, follow me this way here, okay? Here, okay? All right, no worries. What is... Hey, morning, how you guys doing? Hello. Hey, how are you, buddy? I'm Dr. Webb. Nice to meet you. Sorry about the wait today.
No, don't worry.
In period, his imaging studies show disc degeneration disease with a protrusion which is interestingly enough on the left side at L5S1 period. I did explain that at some point this may require surgical intervention period. This is obviously the last resort period. We'll check in approximately 2 weeks to check on his progress period. If he is not making any improvement at that point, we can consider obtaining a pain referral and considering an epidural steroid injection at L5S1 period. So the biggest complaint I have, and one of my biggest frustrations, is actually dealing with insurance companies. This is the absolutely bane of my existence. It's frustrating because insurance companies, they dictate how we practice medicine, sometimes what medications I can prescribe, what surgeries I can perform. There's literally insurance companies that tells me what implants I can use in surgery. If I don't use an implant that is dictated by the insurance company, then they won't pay me. Most frustrating part of my job, and I see why a lot of people become just really irritated with our medical system. We have some of the highest rates in terms of what they charge people for health insurance, but when people need insurance to use it, they can't. So I have a patient I just saw who has a severe collapse, has severe compression of her nerves, back and leg pain. And I'm fighting with the insurance company right now because she needs surgery. They stated that since she didn't have physical therapy this year, she had it like last year, that they want to approve her surgery, which is crazy. I can't see this lady proceeding forward with life without some type of intervention. And she's failed everything else. So the most frustrating part of my job is dealing with the insurance companies. A lot of the insurance companies, they have surgeons that work for them. And I have to get on the phone, spend time out of my day that is not paid to argue with the surgeon that works for this insurance company and try to explain to them why this patient needs surgery. I'm literally going to bat for my patient. Frustrating. All right, so I have a podcast interview now with Dr. Glockenflecken. He's a physician, also comedian. We're just going to be chatting about a little bit about my story, my path, social media journey, things like that. About to log on. I have 10 minutes before we get started, so just finished seeing patients here in the clinic and going to jump on this podcast interview, get set up here, and hopefully get started soon. So you guys gonna chime in and listen in a little bit during this interview. I appreciate it, and thank you guys for having me. Yeah, it's been a pleasure chatting with you, and yeah, much success to you and rest of your practice and social media as well. All right, so just got done with a podcast interview. Went well, Dr. Glockenflecken, and yeah, so that kind of concludes my day here. I'm about to get some work done, and then we have to talk later this evening at UTSA. This is a school where I went to college, and they invited me to come speak to the students tonight. Hopefully should be a good turnout. I'll just be telling my story, giving some advice to the students. So yeah, we'll see you guys there. All right, guys, so I just got here to UTSA. This is the place where I did my undergraduate degree, got my undergraduate education. We're here to talk to the students today about my path and just give some advice, sign some books. So yeah, should be a good event tonight. All right, so this is crazy because it's been 10 years since I graduated from medical school, and to be able to just give the students a little bit of advice about my story and background, and so I'm looking forward to the talk tonight. So, just got here, UTSA, the auditorium, about to get set up. as a surgeon or as a doctor, there's only so much that you can do within reason, right? We go through all this training to help patients, but there are also some patients that unfortunately I can't do much for as a surgeon. So that's one of the hardest parts of my job. All right, no worries. What's up, man?
Dr.
Thank you,
Webb.
man. All right, guys, that concludes my day. Just got done with my talk here at UTSA. Just wanted to thank you guys for hanging out with me today and just hearing my thoughts about the issues that we face as surgeons and doctors, healthcare providers with insurance. Huge problem. I'm hopeful that things will change, but make sure you like, subscribe, and we'll see you on the next one.